Picture this.
Yeah.
A silent situation unfolding inside your furry friend. Something completely hidden until maybe a routine vet visit.
Or things take an unexpected turn, yeah.
Forget about those telltale signs like a missing slipper. We're talking about an internal issue. Today on Deep Dive, we're exploring the health of our dogs and cats, focusing on a specific non-cancerous liver growth called hepatocellular adenoma.
Exactly. A hepatocellular adenoma is, well, basically a benign tumor. It starts in the main cells of the liver, the hepatocytes.
Okay.
And what's really interesting, I think, is that these non-malignant growths might actually be more common in our pets than primary liver cancers.
Wow, really? More common than cancer?
It's a detail that could surprise quite a few people, yeah.
Absolutely. So to get our heads around this, we've been digging into a comprehensive overview on canine and feline hepatocellular adenoma.
Mm-hmm.
Our goal for this deep dive, especially for you, the learner, is to, grasp the key aspects, how it shows up, how vets figure it out, what the usual outcome is, without getting totally lost in complicated medical jargon. We're aiming for those surprising nuggets and the most important stuff you need to know.
Good plan.
So let's kick off with who actually gets these? Who's affected?
Well, first thing to say, while we're talking about it, hepatocellular adenoma is actually not very common in dogs.
Oh, okay.
And it's quite rare in cats. Very rare.
Right.
When we do see it in dogs, it's typically in older dogs, generally over the age of 10.
Older dogs. Makes sense. Any particular breeds?
Interestingly, no. There haven't been any specific breeds identified as being, more prone to developing them.
Okay, so it's more of a senior dog thing, not really linked to breeds. Now, you mentioned something, or rather the source did, about them usually being asymptomatic.
Yes, that's a really critical point.
So they often go completely unnoticed.
That's precisely it. The fact that these tumors often don't cause any outward signs is like a key feature. They're frequently found incidentally.
Incidentally?
Meaning they're discovered when tests are being done for something else entirely, like routine senior blood work or an ultrasound for a different reason.
I see.
But there's a more dramatic side, though it's less frequent. Sometimes a tumor can suddenly rupture.
Rupture. That sounds bad.
It is. It can lead to what's called hemoperitoneum that's bleeding into the abdominal cavity.
Okay.
And this can cause shock-like symptoms, weakness, hypovolemia, which is a big drop in blood volume.
So a seemingly healthy older dog could just suddenly collapse.
It's possible, though, again, less common than just finding it by chance. It really highlights why those senior wellness checks your vet recommends are so crucial, doesn't it?
It really does. They might just stumble upon something like this.
Exactly.
So mostly quiet, but sometimes they can present quite dramatically.
Are there any other signs? Maybe if the tumor gets really big?
Yes, sometimes. If a tumor grows quite large, it can lead to more noticeable signs, though they can still be a bit general.
Things like pain in the upper abdomen. Maybe the dog seems uncomfortable when you touch their belly. And also maybe some vomiting or just a reduced appetite, being off their food.
Okay, so a mix of hidden and sometimes vague symptoms. That makes early detection sound like a real challenge.
Like it can be.
What about the cause? Do we know why these happen? Any known risk factors?
That's actually one of the more, puzzling aspects. The exact cause. Specific things that make a pet more likely to get one.
Yeah.
They're currently unknown.
Really? So
Okay.
it just happens.
Pretty much. There's no clear trigger identified yet. It's an area for ongoing research, for sure.
Huh. Bit of a mystery then. Which makes preventing them impossible, really.
Right.
Okay, let's talk diagnosis then. If they often don't show signs, how do vets usually find them? What's the process?
Yeah, the diagnostic process can be a bit like detective work because, standard blood tests.
CBC, chemistry panel, that sort of thing?
Exactly. They're often unremarkable. They don't typically raise immediate red flags.
The blood work looks normal.
Or close to it. Liver enzyme levels like ALP, ALT, AST, they can be variable.
Variable how?
Well, they might be completely normal, or they could be anywhere from slightly high to sometimes significantly elevated, but it's not consistent. And importantly, bilirubin levels, the thing that indicates jaundice, that's usually normal.
So you can't just rely on blood tests to pick this up?
Not reliably, no. Think of liver enzymes like little flags. Irritation or damage makes the flags go up. But with these adenomas, the flags might not go up, or only a little bit.
Got it. What about other lab work? The source mentioned serum bile acids.
Yeah, serum bile acids are usually normal too, unless the tumor gets so big it starts affecting blood flow through the liver or the flow of bile itself.
So only if it's causing a blockage, kind of.
Sort of, yeah. Or affecting perfusion. And there's a rare thing, clotting problems, DIC, disseminated intravascular coagulation.
Oh, right.
That's typically only seen with really large tumors that have started to break down or bleed internally. Very uncommon, though.
Okay, so blood work is often not the key. That leads us to imaging, I guess. X-rays, ultrasounds.
Imaging is really important here.
Yeah.
Radiography, X-rays might show a mass, or maybe the liver looks an odd shape.
Just maybe.
Yeah, it's not always obvious. Rarely you might even see gas pockets if there's tissue death in the tumor. But abdominal ultrasound, that's often more helpful.
Ultrasound. Okay, what can that show?
It can usually identify a distinct mass in the liver, and this mass can have variable echogenicity.
Echogenicity, meaning how it looks on the screen?
Exactly. How it reflects the sound waves. It might look brighter, darker, or a mix compared to the normal liver. It could be a single lump, multiple smaller ones, sometimes even fluid-filled, like a cyst.
So ultrasound gives a better picture. What about CT scans? Are they used?
Abdominal CT, yeah, that can be particularly useful, especially if you're thinking about surgery.
How so?
It gives a much clearer sort of 3D view, shows the tumor size, exactly where it is relative to things like the gallbladder or major blood vessels.
Right, helps plan the surgery.
Exactly. And it can be better at spotting any other small lesions in the liver or elsewhere that maybe the ultrasound missed.
Okay, so imaging helps locate it, but it sounds like you still might not know for sure it's just an adenoma. The source mentioned taking samples. Cytology and biopsies.
That's the next step, usually. Hepatic aspiration cytology that's using a fine needle, often guided by ultrasound, to suck out a few cells.
Okay.
It can help identify normal liver cells, or maybe slightly abnormal ones. It's pretty good for ruling out other things, like lymphoma, a type of cancer.
But can it confirm it's an adenoma?
Unfortunately, not reliably. It often can't tell the difference between a benign adenoma and a low-grade, slow-growing liver cancer, a hepatocellular carcinoma. The cells can look quite similar.
Tricky. So what about a biopsy, like a bigger sample?
Right, a hepatic biopsy using what's called a Truckett needle. That takes a small core sample of the tissue, not just loose cells. You usually need several samples.
Is that definitive?
It gives more information about the tissue structure, definitely. But honestly, even with a biopsy, telling the difference between an adenoma and a low-grade carcinoma can still be challenging sometimes. The microscopic features can overlap.
Wow, so it really can be a diagnostic puzzle.
It can be.
So what is the most reliable way then to get a definite diagnosis and also potentially treat it according to our source material?
Well, the source points to abdominal exploratory surgery.
Going in and looking.
Exactly. And then resection, surgically removing the mass, typically the whole liver lobe it's in, which is called a lobectomy, and then sending that entire removed tissue for histopathology.
Examining the whole thing under the microscope.
Yes. That's considered the gold standard. It gives you the diagnosis and it's the treatment all in one go.
That makes total sense, seeing the whole picture, literally. Okay, so let's talk about what these things actually look like. Once they're removed, what do vets see?
Gross pathology, what you see with the naked eye, they're typically well-defined, usually single lumps, often smaller than, say, 10 centimeters.
Okay, what color? Texture?
Often kind of yellow-brown. They tend to be soft, quite vascular, lots of blood vessels, and pretty fragile, actually.
Friable, easy to break apart.
Yeah, but sometimes you can see multiple lumps or they can get really big. The source mentions sometimes even over 20 centimeters.
Wow, that's huge. Over 20 centimeters.
It can happen.
What about under the microscope? What are the key features there, even if it's tricky?
Microscopically, like we said, it can sometimes be hard to differentiate from other things. Nodular hyperplasia, which is common in older dogs, normal liver, or that low-grade carcinoma.
Right.
But typically, adenomas show a well-organized pattern of liver cells. It's called a trabecular pattern, like the cells are arranged in neat little beams or cords.
Okay.
Interestingly, they don't always have a distinct capsule around them. They often just compress the normal liver tissue around the edges.
So they push the normal tissue out of the way.
Sort of, yeah. And the number of cells actively dividing mitotic figures, that's usually low. The liver cells themselves, the hepatocytes, they often look similar to normal ones, but might be bigger, often with clear-looking cytoplasm.
So it's a combination of the structure, the cells, the lack of aggressive signs, like rapid division.
Exactly. It's piecing together those microscopic clues.
Got it. Okay, let's move to treatment. What can actually be done once it's diagnosed?
Surgical removal is the main treatment, especially for larger tumors or if they're causing symptoms or, affecting how organs are working.
And what about that scary bleeding scenario you mentioned?
Right. If a tumor ruptures and bleeds, that's an emergency. It needs immediate care stabilizing the pet, maybe blood transfusions, and then emergency surgery to stop the bleeding and remove the source, the tumor.
Okay, what if a tumor is just too big or in a really difficult spot to remove? Are there other options?
For tumors considered non-resectable, there are some experimental treatments mentioned, things like transarterial embolization or chemoembolization.
What do those do?
They basically try to block the blood supply to the tumor, sometimes delivering chemotherapy directly into it at the same time.
Okay.
But the source strongly recommends getting a referral in these cases, consulting with a veterinary oncologist or an experienced surgeon, because actually many tumors that seem very large can often still be removed successfully with specialized techniques.
So don't give up hope just because it looks big initially.
Definitely worth getting a specialist opinion.
Good point. And speaking of surgery, what should pet owners know? Is removing part of the liver dangerous?
Well, it's major surgery, obviously, but the liver has this amazing ability to regenerate.
Right, I've heard that.
In a healthy pet with good post-op care, surgeons can often safely remove a really significant portion, sometimes as much as 60 or 70%.
Wow, 70%.
Yeah, it's quite remarkable. During the surgery, it's also standard practice to take biopsies of nearby lymph nodes, some normal-looking liver tissue, and anything else that looks unusual in the abdomen.
Just to be thorough, check for anything else.
Exactly. Rule out any other concurrent problems.
Okay. Now, our source didn't mention any medications as a treatment for the adenoma itself. Is that right? No pills to shrink it.
That's correct. Based on this information, surgery is the mainstay. There aren't medications listed as a primary treatment for the adenoma itself.
Okay, so surgery is key. What does life look like after diagnosis and presumably surgery? What's the follow-up?
After treatment, monitoring is important. This usually involves regular checks of those liver enzymes, especially if they were high to begin with, to see if they normalize.
Makes sense.
And abdominal ultrasound is generally the preferred way to recheck the liver area. The source suggests doing this maybe every 3 to 4 months for the first year.
Just keep an eye on things.
Yep, making sure everything looks okay.
Are there any potential complications down the road even after successful surgery? Or if someone doesn't do surgery?
Well, the main risk if a tumor isn't removed is that potential for it to become necrotic where the tissue dies, or, as we discussed, the risk of rupture and severe abdominal bleeding.
Right, the hemoperitoneum.
Exactly. That really emphasizes why addressing these, especially if they're large or causing any signs, is generally recommended.
Okay. But overall, let's say surgery happens, it goes well. What's the general outlook? The prognosis.
The expected outcome, the prognosis after treatment, particularly after surgical removal, it's generally excellent.
Excellent. That's fantastic news.
It is definitely a very encouraging piece of information for pet owners facing this diagnosis.
That's certainly great to hear. Okay, so just to quickly recap what we've covered in this deep dive. Hepatocellular adenomas. They're often these silent liver tumors.
Right, usually found by chance.
And tend to show up in older dogs, much less common in cats. Getting a firm diagnosis can be a bit tricky.
Yeah, involves imaging, often needing biopsy or surgery itself for confirmation.
But thankfully, the outlook after treatment, which is usually surgery, is generally very, very good. Excellent, even.
Exactly. And what's fascinating, I think, is just how something potentially significant growing inside them can stay hidden for so long.
Right. It really underscores the value of those routine vet checkups, especially for seniors.
Mm-hmm. And just paying close attention to any subtle changes in your pet's behavior, things that might seem small but could warrant a closer look.
Absolutely. And it makes you wonder, doesn't it? Considering how, relatively common these benign tumors might be compared to cancers, yet often showing no symptoms. What other silent conditions might be lurking in our pets?
Yeah.
And what role does that proactive monitoring, that consistent veterinary care, really play in their long-term health and well-being? It's definitely something worth thinking about.